Hello, my name's Grant Charlesworth-Jones. I'm the Medical Director at Summerfield Healthcare. Some of you will be aware that we've been using PCR swabs to diagnose the active virus COVID-19, and it naturally follows that after diagnosing infection, we're naturally curious as to whether we've developed any antibodies to COVID-19. I have to stress that the COVID-19 itself is such a new virus that we don't know as much as we'd like to about it at this stage. So it's very important that we're realistic about what this test can achieve. We don't know exactly how many antibodies, what level of antibodies will confer any immunity, although it's more likely that the more antibodies that you have, the greater the prospect of immunity. And when we talk about immunity, we're talking about a reduction in the prospect of having a second infection of COVID-19 and also the prospect of having a less severe case of COVID-19. But as I say, being perfectly candid with you, the research is being done at the moment, but being early into this, we're able to do the test, and as we understand more about it, of course, we'll then be able to apply that knowledge to the test results which you'll get back. In your testing kit, you will find the instructions, which I must labour the point that it's really important just to read through these so that you understand what you're doing and what's expected of you. Inside your kit, you'll find a yellow-topped tube like this, and you simply need to remove the lid, like so. If you look on the plastic container here, there's a little indentation there where you can actually stand it up, like so. Next, you'll use the Alco wipe, which you just simply tear open the packaging and clean the end of your finger. Bearing in mind that at the start of all this, although you didn't see me do this, you do need to wash your hands in warm soapy water. It's important to be in a warm environment as well because we want to make sure there's plenty of blood going to the surface of your skin under the finger. So you're going to use the fleshy part of the side of your finger, and just bear in mind how you're going to be able to get that blood into the tube. There's a slight lip on this side to help you to catch every drop of blood. So what we're going to do, using the blue lancet, we're going to just pinch the finger slightly, press this on the fleshy part of the finger too, and 1, 2, 3, and there you are, a little drop of blood. You wipe that first drop of blood away, and as can be seen, just give it a moment, and if you make sure that we use gravity to help us as much as possible, we're then going to start getting some blood, which will then go down into the tube. And if you look, you've got a scoop on the side of here, and as the blood comes out, you can literally scoop it straight into there like that. What we found as well is if you're standing up so that your arm is hanging down, that will encourage, through gravity, encourage the blood going down to the finger and create slightly greater pressure. The blood does come out a bit quicker if you're standing up doing this. Here we are. It does take a minute or two. Everyone's a little bit different, but it does take a moment or two to fill the tube. And it's got to be filled to at least the lower of the black lines. That's 0.5 mils. If you can get more in it, then that's great to do that. Once you've filled this to the 0.5 mil line, you can simply put the cap back on again. You'll hear it click. You can turn it backwards and forwards, just gently agitating the sample between 8 and 10 times. You've got to put your name and date of birth on the label on the tube. Within your pack, you've also got a pathology form, which is a piece of A4 paper on which you'll see there's space to put your name and date of birth. There is no need, please note, there is no need to put a reference number on this. So finally, you've got your name and date of birth written on the sample container. You put this in the protective outer. I must stress that it's so important for you to write your name clearly and legibly in capital letters, and also to write your date of birth clearly. So with the pathology form, the sample. This goes into the plastic envelope, and that's sealed, and that will then go off to the lab. Okay, so this testing kit process is very easy. Take your time to do this. Remember, you want to wash your hands thoroughly to start with. Make sure they're nice and warm. You're going to be using the Alco wipe to disinfect the finger. You're going to be using the fleshy part of the finger to use the lancet. You've got to remember that everybody is different, so the blood will come out at different rates. Remember that the collection tube has got a little scoop on it for you to scoop up the droplets of blood. You're provided with 3 lancets, so that you may actually, if some people who are slow to bleed, you may end up using 3 lancets on 3 separate fingers, each one used with the Alco wipe, that'll be fine, to actually get the amount in the sample, and it's the lower line, 0.5 mils, that we need. You've got to remember to turn it and gently agitate the contents of the tube, label it with your name and date of birth. You've got to do your pathology form legibly and correctly, so name, date of birth, and remember there's no need for a reference number. It all goes in the packaging, into the plastic envelope, and away into the first class post.